Hey, happy Friday. Welcome back to Lab Rat Sherry. And this week we are still watching the Pitt. Let's see what's up with this week's episodes.
Okay, differential diagnosis.
Schizophrenia, first psychotic break. She's in the right age range.
Yeah, what else?
Drugs, also common in this age group.
Common in all age groups. What else?
Not just recreational drugs, could also be toxicity to medications.
Don't jump to conclusions, think big categories and then specifics.
Metabolic, hyper or hyponatremia, calcium, hepatic encephalopathy.
Endocrine, hyperthyroid, infectious encephalitis.
Those are all possibilities. Okay, let's work her up medically, see if we can clear.
Chem panel, CBC, TSH and T4, drug screen, and HCG.
Yep, keep me posted. If it's all negative, then we better decide.
Normally, if we have a high suspicion on someone having infectious encephalitis, a CSF fluid for culture and cell count would be ordered and sent to lab for testing. But I guess they didn't place that order because this patient is extremely uncooperative, and that test is such an invasive procedure. It literally pokes a hole on your lumbar. If a patient keeps trying to flinch, it would be pretty dangerous. But it is an important test if someone need to know the answer for definite. And once the sample arrives in the lab, it's instantly become a stat order. It doesn't matter if it was ordered as a routine, it just instantly bumps everything else off the line and becomes the stat. The only time this test would have a delayed report is for the hematology differential part. If this sample just meet the criteria of doing a differential, but it doesn't have enough cells to do a quick cell count, that's the time whoever get this sample will have to give the microscope a death stare and trying to find every single cell on that slide. I've been there many times and I don't like that.
Here we go. ABG.
Looks good. Let's do this.
We are surprisingly getting a correct turnaround time. That little device that Dr. Robbie is holding is a point of care, and yes, doing a blood gas on a point of care device is super fast. It's done within literally 2 minutes. However, there's one thing I need to make clear over here. The collection process of ABG is not a super fast collection process. Unlike the VBG, which is venous blood gas, you can collect the blood just like how you regularly draw in the blood from a patient. A ABG, arterial blood gas, you need to draw the blood from somebody's artery, and artery is very deep. And normally, you would need some ultrasound guidance to get that sample and to set it up and properly find the place and get the sample. That's not super fast.
Hard and sleep deprivation, all while you wait for a bed upstairs.
Hey, Nandi, the influencer in Central 8, still waiting for psych?
Nope, she's a keeper. Her mercury level's sky high from that face cream.
No,
I ordered chelation.
no. No. Look, we were just talking about we were just talking about they had the right turnaround time in the last episode, in the very last episode, and now this, what is this? Look, listen. She ordered a heavy metal panel. That is a send-out test. As far as I understand, from years of working, most of the hospitals in the northeast of the United States will choose Mayo as their reference lab. And that heavy metal panel test that she just ordered in the very last episode is going to Mayo. At this point, that test hasn't even left the hospital yet. There's no way she got a result, okay? And yes, some hospitals still offering the blood lead as a in-house testing, but not for mercury, okay? Not for mercury. And for that lead test, there's no such a thing called you are in a stat order either, unless you got such a special condition that you are literally possibly gonna die very soon. Other than that, if you just have slightly altered mental status and everything else looks perfectly fine, what happens to that sample is they will be putting into a batch and then being placed on our analyzer in a group, okay?
A 20 gauge needle and some sterile saline.
Pluck it out, stitch me up, and send me home. I've got to get back out there to my kid.
Well,
He's still waiting to be seen, by the way.
Afraid it's a little more complicated than that. You got yourself a fight bite, which means a couple things. First, we need to determine if the bite extended into the joint space. If it did, you're gonna need IV antibiotics and a trip to the OR to see a hand surgeon. Pinprick and a little burning.
An operation?
Well, you're just shouting a minute ago about infection. And with good reason. While I am sure you are in the clear for rabies and HIV, human mouths are filthy, some more than others.
What Landon said is completely true. We humans are very dirty. Our saliva contains loads and loads and loads of bacteria. If you get a bite deep into your tissue, the staph, the strep, the echinella, the etc. and etc. would be getting into your tissue and then give you cellulitis and all the other stuff. You know, sometimes I kind of wondering if you have to get a bite, are you rather to get that from Komodo lizard or are you rather to get that from another human?
She needs saline. We don't have her last act yet. At festivals, you dance for hours, you sweat, you drink gallons of water, but nobody thinks to replenish their salts. It's low sodium, hyponatremia. She needs 100 cc's of hot saline.
We don't know her sodium levels.
Just drop 100 cc's of 3% and have it ready, okay?
Do it.
And prep a gram of Kepra, now. Start the Kepra, please. It's not gonna help.
Problem 1.
What are you doing?
Got it. Thanks.
It's hyponatremia. Serum sodium is critical, only 112.
You know what? If I don't remember wrong, in the last episode, they were literally holding a point-of-care device. The point-of-care device, that model, that hold in Dr. Robbie's hand, that thing can run a blood electrolyte, which include sodium, and it only takes 2 minutes.
Purulent drainage from the cervix. Got the culture? Oh, looks like we have our source. The positive urine this morning was contaminated.
Maybe.
Okay, couple things over here. So first, the good part is they did use the correct swab, which is kind of surprising to me because in my work, there are the times that our real doctors and real nurses will be occasionally picking up the wrong swab for testing. It happens more often than you would think. So that's a part I would give their credit for. They actually did figure out which swab is the correct one for bacteria testing. However, here is the other thing. They did not know the morning specimen was contaminated. They did a UA, a urine dip, which means it's a chemistry only test. And guess what? If you only order a urine chemical, yes, there is no way for you to tell if the urine is contaminated. However, if patient is having signs of infections and all that, why don't you add on a urine microscopic test? Because in that part of the test, you would be able to figure out this urine sample is contaminated. In that report, we will tell you if there is epithelial cells, which is a huge indicator of if this sample is contaminated, and also if there is a vaginal contamination, there will be fibrin in there too. So if you didn't want to do a add-on test, why don't you order a reflex test from the beginning? Like when you get everything normal in the dipstick, it reads out by itself, but then if anything shows any signs of infections, it will automatically reflect a microscopic testing. That way you do not miss anything. So hey, hear me out. If you're a doctor or a nurse, has to happen watching my videos right now, please get your order right. Okay, that's all for this week's episodes. Am I super disappointed? Not quite, because the mistakes they made in these episodes are kind of expected at this point. It's very sad to say. Now I start to expecting they making mistakes on laboratory parts, but hey, if you lower the bar, you are not going to be that angry, right? Although I know I had a couple of snaps over here, but I think my tolerance has been getting higher. Thank you for watching. This is Lab Rat Sherry, and I'll be seeing you next week.